Hey, David. Thanks for joining. Hi, Heather. Oh my gosh, we have a ton of people. Yay! All right, so I'm kind of dual monitoring this right now, just so that I can see everybody's comments better, and hopefully the picture is better this time since I'm using a different camera. So we'll see how this goes. I'm gonna give everybody a few minutes to do their thing and log on, and we'll get started. I'm really excited. I think we need better light. All right, is that light better? Hi, Felicia. Come on, Jinx. We're gonna have, I think, lots of fur guests tonight. Hi, Renee. Thanks for joining. Katie, hi. Thanks for joining us. Hi, Amy. Welcome. We've got a decent crowd popping on, so that's awesome. All right, I'm gonna try and manage this tandem screen. I'm using a different camera. I'm using my iPhone to actually film, and then trying to use the larger screen on the computer to actually see everybody's comments. Hopefully that will help me out and it won't look too weird for everybody. So bear with me as I'm trying to figure all this technical junk out. We're gonna give maybe another minute or so to let people jump on, and then we'll go ahead and get started. I know that I do have some of my midwife colleagues who are gonna try and make it tonight. Hey Chris, thanks for joining. And you know, give you guys some really great information and resources, and really, you know, I don't have a whole lot of talking tonight. I really want to delve in. I'm going to give you guys the information that I do have, and then just take your questions, because I know a lot of people have heard some information about midwifery, or just have general questions about midwifery and aren't really sure that we are, you know, aren't really sure what midwifery is. Yes, Katie, I actually have tea here. Hey, so we're going to get started, you guys. Grab a cup. And thanks for joining me in the parlor today. Actually, today is exciting because we, this being only our second episode, we have a sponsor tonight. My friend Dave from Rusted Leaf Tea actually sent me my new absolute favorite tea this week. And Dave is a local guy here in Ohio. And he sent me this cute little sample package that has all 4 different flavors of his teas. And it's a mix of delicious black teas and herbal teas. So there's some teas that are just for fun and occasionally, and others that I would absolutely recommend for any time because they are pure herbal teas. My favorite right now is the Leaf on the Vine, which is jasmine tea flower, and the jasmine flowers and spearmint. It's delicious. That's actually what I'm drinking tonight. But this cute little kit, and I'm going to link Dave's info after the episode tonight down in the comments so you guys can reach out to him. But thanks, Dave, for sending me this stuff. Not only did this little kit have the 4 different teas in it, it also comes with a fancy little strainer infuser set. Like, how cute is that? My cat is going to love this later. And a nice teacup. And I know he has a couple of different gift sets, too. So that's exciting. And the teas are really delicious. I'm so excited about these teas. So thanks, Dave, for sponsoring today and for the yummy tea. Hey, Penny, thanks for joining. If I missed anybody, hey, Sam, thanks for joining. We are really, really fortunate. Hey, Diane, thanks for coming on. So yes, I am having my favoriteest jasmine tea tonight, and normally I'm drinking like red raspberry leaf. Hey, William, how are you, honey? But tonight I'm gonna have the jasmine. I've actually gone through like 2 pots of this jasmine tea today. It's so good, so good. So I'm gonna go ahead and pour my cup, and we'll get started if you guys are ready. Also, I just want to say thank you guys for jumping on the bandwagon here. Hi, Joe. Thanks for joining, and letting me on camera exhibit my tea fetish and pull out all my good dishes that I only use occasionally because it's just me here in this house with the animals, and the only time I really use them is, well, not as often as I should, I guess. You know, why not every day, right? Take my own advice on that. So we're talking about modern midwifery today. Hi, Audrey. Welcome. And I just want to start this off by really emphasizing that the information I'm giving you is based on my education and my experience, and also my personal philosophies. I'm going to share some of that along with some facts. Hey, Jason, Eric, thanks for joining. And just kind of get into it. So in this day and age, we've got a lot of different information out there about midwifery. And so I want to start by just explaining the different types of midwives that are out there, because there are a couple of different types now. There are certified midwives that often go through like a college education course and then sit for an exam and then go out and do the work. There are what are called lay midwives or direct entry midwives, whose education course consists of a lot of apprenticeship, getting out in the field, working with other midwives who typically start out as birth assistants and then work our way up to doula, and then from doula become a midwifery assistant, and then from midwifery assistant we become an apprentice midwife, and then our proctor midwife, which would be the midwife that oversees us as we're training, decides when we are competent enough to lead a birth, to be the lead midwife, and then they kind of step back and let us lead, and we have to go through several of those before getting released to kind of do it on our own. And that's the route that many midwives take, because the education process can be really restrictive, And a number of states, including Ohio, are restricting the schooling, not the schooling, but the specific schools that they will recognize for midwifery certificates. I have kind of a hybrid training as far as like home birth midwives go. Hey Steve, thanks for joining. And in that I had my minor is in midwifery, and I got the majority of my training as an apprentice, doing apprenticeships and internships and really hands-on training, like in the field. This is what happens, here's how we handle it. And I gotta say, I personally feel like that's the best route to go, because when what you get is mostly book learning and theory, and then you pass a test and you get out into the field, it's a whole nother ball game. Hey Linda, thanks for joining. So those are the types of midwives that typically will handle home births. Now there's another type of midwife. Hey Valerie, thanks for joining. Which would be a certified nurse midwife. And the training for that is very different. They are nurses first. They are first trained as medical professionals and then given some midwifery training with, what's the word I'm looking for here? Limitations on how they perform as midwives underneath of a medical scope. So I think something to clear up here is that midwifery, like naturopathy, is not a medical field. It is completely separate from medicine in that, into the 40s, we were still primarily birthing at home. Hey Erin, thanks for joining. And so, and that's the 1940s, guys, the 1940s. So only about 80 years between when we were still primarily birthing at home. Hey Dave, thanks for joining us. About 80 years from, when we were still primarily birthing at home to now when the majority of births are hospital-based. And somehow in that short 80-year span, we went from pregnancy and birth being a natural, family-centered life event to a medical condition that requires hospitalization. And I'm not really sure exactly how that happened. I do have information, but it's way more than I want to share here and kind of takes us down a rabbit hole. So, we need to look at the options here as birthing in recognizing that pregnancy and birth are a life process, and midwives are trained to understand that process and recognize deviations from the norm, as well as understanding variations of the norm. So let me just explain that for a minute, all right? I want you guys to take a look at your earlobes. And so my earlobes are separated from the side of my head. Some people have earlobes that are partially separated. Some people have earlobes that are completely attached, which is normal. I'm going to wait for somebody to answer. All, yes. Thank you, Amy. Yes, all of them are normal. They're all variations of the norm. Thank you, ladies. Yes, all three. They're all variations of the norm, not deviations from the norm. So deviation means that it is no longer normal. Variation means that it is normal, and can be different for each person. And these are things that we see within every birth and every delivery, every pregnancy, whether that, every mom is different and every pregnancy for that mom is different. Hey, Connie, thanks for joining. So we need to keep that in mind. And what midwives are actually trained to do is to understand that variation. Whereas the medical field is, OBGYNs are surgeons. They are trained as surgeons. They are trained to look for pathology or deviations from the norm and correct it with medical procedure. All right. So what happens is that they have this set of guidelines in the hospital, and if you don't follow that set of guidelines, you are deviating from the norm rather than being a variation of the norm. Midwifery works to support that birth and maintain the norm while being aware of signs that could be an indication of complications or deviation from the norm, and being able to advise and support the mom. All right. You can typically find a direct entry midwife by asking around. Depending on the state that you're in, there are some taboos about home birth, and some not really taboos, but kind of misconceptions about home birth and a lot of fear surrounding that. Awesome. Hey, so Katie is with us, and she only attends out of hospital births. Katie, what part of Ohio are you in? Because I want to make sure that we're getting everybody all their info. So let's go. So CNMs and DEMs, or direct entry midwives, sometimes called lay midwives, we typically are the ones who will attend home births, and many of us, like Katie just said, only attend out of hospital births because, especially here in Ohio, the culture and the atmosphere around midwifery is very weird. Very weird. There's a lot of fear-based stuff going on. I know with all this coronavirus stuff going on, we're seeing an influx of people calling into midwifery businesses and talking with midwives and being told that their OBs are telling them to birth without assistance if they don't want to be in the hospital, which is really scary. So what you will find in the hospitals typically are your nurse midwives, particularly here in Ohio. If you are not a nurse midwife, or sometimes the CNMs can get privileges in the hospital, but mostly here in Ohio, it's just the nurse midwives. So you want to ask when you're talking to your midwife, hey, what are your credentials? How are you trained? And also, keep in mind that the different styles of training don't necessarily mean a better midwife. I don't believe that CNMs, DEMs, lay midwives, or nurse practitioners are any better than the other. We all have specialized skills and approaches and really good knowledge, and it's more about how are you jiving with that particular midwife. Do they listen to you? Do they make you feel comfortable? Do they answer your questions in a way where you feel like you are making an educated decision and not making a decision out of fear? I highly recommend, with any practitioner in any setting, that when you are asking questions, and you should ask lots of questions, there is no such thing as a stupid question, except the one you don't ask. So ask those questions. And I really feel like if that person is not answering those questions in a way that sets you at ease and respects you as an individual, rather than creating an atmosphere of fear or demeaning you in some way, then that's the person you need to go to. You know, you need to go to that person who respects you as an individual and will listen to your concerns and your wishes and help you to reach that. So with nurse midwives, again, they're primarily trained as nurses and then given some midwifery training, and they primarily function within the hospital settings. I just lost my place. Hang on, let me check my notes here. All right. So how do we as midwives approach pregnancy, birth, and postpartum? So the rest of this talk today is going to be from a home birth midwife philosophy and approach, because that's my approach. I really don't have enough interaction with nurse midwives to give any kind of opinion on how they approach it. So again, you need to be interviewing these caregivers and making sure that you are comfortable and feel as though you're getting the care and the understanding and the support that you need. Because more than anything, as birth companions and as midwives, our job is to support you in your birth. So if that means that you're having some emotional stuff that's coming up and you're really struggling with it, then we take the time to talk about that with you and help you to process that, so that anything that can be creating a physical manifestation, whether that be a slow labor or a stalled labor or anything else that I've seen happen with emotional stresses that haven't been worked through, that we help you work through that so that you have a better outcome and a better experience with your birth. So let's just talk about our approach to pregnancy. I mentioned earlier that, you know, the approach to pregnancy and the belief that pregnancy is a natural life process, family-centered. That's the approach that I take, and most of the midwives that I work with as well, because of course we are home birth midwives, and so it's you're on your home turf and you're working there. You've got your family around you. I've had moms birth with their pets near them. I've had moms birth with their older children around them, and it's a wonderful family centered event. I don't know if I can step out of here and put that on airplane mode. Sorry. So what we do with that is that we look at the individual, and we're looking at ensuring that we've got good growth, good heart tones, a healthy environment that is, you know, not just physical environment, but also an emotional environment, also, you know, a healthy diet, and an approach, you know, to life, making sure that we're discussing with the mom things that are going to serve her highest good and the baby's highest good throughout the entire pregnancy. That's the goal there, is to just really support that natural process and maintain a healthy pregnancy as a healthy pregnancy. Oh my gosh, we've had a whole bunch of people join. So Stephen joined us. Thank you so much for joining. And Jim, welcome. Thanks, guys. Appreciate you hopping on. You know, I think the biggest thing that people ask about is birthing. And there are so many variations of birthing, particularly at home. Some moms get up and walk around, some birth in their bed, some squat down, some get on all fours, some birth in the water, some labor in the water, and some labor outside of the water. Oh, Katie, good luck. Katie is on her way, actually, on a labor call, so yay, happy birthday. And, on top of that, we're working to also maintain the bonding between mom and baby and the rest of the family and their new family member. As far as postpartum goes, most midwives, and again, I'm speaking from a home delivery midwife perspective here, we do a lot of aftercare. For me, I typically include 6 weeks of aftercare with any birthing contract that I have. Someone contracts me to attend for them, then that will include prenatal visits, consultations, attending the birth, taking information and documenting everything during and after the birth, as well as 6 weeks of postpartum care, where I come in and we, talk about anything that mom might be struggling with, whether that be breastfeeding or emotional changes. Sometimes some moms get lots of emotional roller coasters, particularly after their first baby. And then some after their second, because it's very different to have one little one dependent on you versus, oh my gosh, now I have several running around. So that support is something that happens within midwifery that you typically do not see with hospital births. My philosophy on this is always from a naturopathic standpoint, which is that we are working with non-invasive, non-toxic care that supports the body's natural systems and processes. That doesn't really change within midwifery versus naturopathic care. Hey, Doug, Jess, thanks for joining us. So one of the things that I often tell people is that this is something where education is absolutely paramount. So throughout the process of working with a midwife, taking time to educate yourself and listening to the advice of a midwife, which gives you resources and information to help you understand the process that you're going through, particularly if you're a first-time mom, and also, just to refresh things and help you have a good outcome and pregnancy, throughout. That's something that is really important to me, because first and foremost, I'm an educator. My job really is to be the coach, whether I am seeing someone as a naturopath or I am working as a midwife and attending a mom throughout her pregnancy and delivery. So in order to be a good coach, I have to make sure that I'm giving you the right tools and teaching you how to use those tools. And then it's your job to pick up the tools and use them. So that is kind of in a nutshell how we work with moms. One question that I often get asked first and foremost in just about every initial consult with new moms or new parents, because I'm often meeting with both, which is fantastic. We need the daddies to be involved. You guys are important. That is that, how safe is this? How safe is delivering at home? And I want to say that compared to the old days when we did not have access to medical care for emergency situations, true emergency situations, that it is much safer now to birth at home than it was back then. Because in the event that there is actually a medical emergency, we have the option to transfer into a hospital. And a simple call ahead, letting the hospital know, hey, we were transferring in a mom, here's what's going on, gives them time to prep. And most everyone lives within about 30 minutes of a hospital or less. And that's about how long it takes a hospital to prep for an emergency. If you were in the hospital and something were to happen, it would take about 30 minutes for them to fully prep for that emergency situation. However, statistically, less than 2% of women actually require medical intervention. Less than 2%. I want you guys to digest that for a minute. Compare that actual need for medical intervention to our cesarean rates with hospital birth, and there is a huge disparity. So I guess from some perspective, you could say that it is safer to birth at home for a healthy pregnancy, in that there is far less opportunity for the use of medical intervention where it's not appropriate. Because remember that the medical protocols for pregnancy were designed for emergency situations. And when you take an emergency protocol and apply it to a normal situation, it creates situations that require additional medical intervention, or causes situations because of the inappropriate use of those protocols. It creates those situations where then additional medical intervention is needed. So I'm going to kind of stop rambling for a minute, and I'm going to give you guys a little while to just start asking questions. What do you want to know about home birth and midwifery? What are the top questions for you? Sky's the limit here, guys. Is there anyone out there currently pregnant and considering a home birth, or know someone who is pregnant and had questions about midwifery, or just curious in general about birthing outside of the hospital and what those options are? Brian, thanks for joining. Welcome. We are just starting our Q&A. Any questions about home birthing or birthing outside of the hospital, options there, or just midwifery in general? So I know we've got a number of people from different states and everything. Thanks, Amy. Appreciate that. I think this is probably one of the hardest topics for me to talk on because everything is so different for each birth, and it's really, I've always found it challenging to come up with specific information for people outside of the basics, because once you get out of the basics, then it's really about personal concerns and personal situations, things like that. So, okay, so what would be a situation where someone would not be a good candidate for home birth, which is a fantastic question. I gotta tell you, I tend to go mom by mom and not risk people out without a full assessment. There are a few things, though, however, that I would immediately say, listen, this is not a good idea for you to birth at home. One of them would be any kind of blood clotting factor. If there's any issue, hemophilia, anything like that, that you are at risk for, then it's typically safer to say, hey, you need to not birth at home. Also, I'm a strong proponent of VBAC, or vaginal birth after cesarean. However, if you have had more than 2 cesareans, the risk of uterine abruption or tear in the uterus at the incision point is very high. And typically I'm extremely cautious with those sorts of cases. And again, I take it case by case. Often I'm asking, why was there a C-section? Why were there multiple C-sections? And most often, the reason that I'm given for multiple C-section is that the OB said, you can't VBAC after a C-section, I won't do it. Which is unfortunate, because the more cesarean sections that a woman goes through, the more risk that she is exposed to. It's major abdominal surgery. We risk adhesions and scar tissue from the uterus healing, growing into organs surrounding the uterus, and any number, a number of complications from that as well. There's also higher risk of uterine atrophy during labor, and uterine abruption during labor, meaning that during contraction, the scar tissue at those incisions can open up, which can lead to amniotic fluid leaking into the body cavities and causing an amniotic embolism, which can be life-threatening or fatal. What other questions do you guys have? So I have a rule that there is nothing off limits for discussion. However, if it's inappropriate for this particular audience, I might recommend a private conversation. So what other places are available for birth other than the hospital and home? So there is an option for birthing centers if there's one near you. That is an out-of-hospital option. Typically, home and out-of-hospital, home and birthing centers are the options for out-of-hospital births. Birthing centers are kind of the middle ground between the hospital and a home birth, where there's a little more medical equipment and technology and procedure available at birthing centers versus, at home. With at-home births, depending on the midwife, and I will say this, as home birth midwives, particularly if we are direct entry midwives, and even in most cases the certified midwives, it is outside of our scope to administer pharmaceuticals or do other medical procedures. What that means is that if there's a need for that, we will if there's a need for that, a good midwife will say, this is outside of my scope and we need to transfer, if there is a need for it. However, there are other options often for mitigating some of the things that might have elicited medical intervention if you were in the hospital. A slow labor does not indicate that you are failing to progress. It means that you are progressing appropriately for your pregnancy. I find often that moms will stall out at some point. We'll often see them, start to dilate, and we'll get to about 4 to 5 centimeters, and maybe they'll stall out for a few hours or more. I've had moms, be in active labor and get to 5 centimeters and then stall out for 4 or 5 hours. And really the thing to do is just be patient and wait. It doesn't mean that things aren't working correctly. It means that we just need to be patient, that your body is taking a little bit longer. It's taking a break, and it's gearing up for the next phase of the marathon. Also, I tend to notice that, where was I going with that? Sorry. Apparently that point was not important. Oh, yeah, okay, medical intervention. So, often what I will see is that within the hospital, there is a failure to wait syndrome. The expectation that you're going to labor and birth within a specific chart. Hey, Natalie, thanks for joining. And if you don't fit within that chart, then again, a failure to progress is one of the top reasons given on medical forms to justify a C-section. And again, I feel like it's really failure to wait, in that we are expecting everyone to fall within the specifics of a chart that was created, by the way, back when the majority of women waited much longer to go into the hospital to deliver than we do today. So those early hours of first stage labor where things can be kind of stop and start does not look the same as second stage labor, when the body's really ramping up for the big work, and mom's having to work really hard in that stage of labor. So stalling out and getting frustrated with that, and then applying a medical procedure to that, actually creates more problems. We're trying to override our natural processes, and anytime we try to override the body, we're just asking for something to happen, especially when we're dealing with natural processes, like birth. So, what other reason would I risk someone out? I have risked women out because of refusal to comply with dietary regimens. Listen, if you are smoking, drinking a ton of coffee, filling yourself up with pop, and just regularly abusing your body with crappy food, you're not going to have very good outcomes with your delivery, because your body doesn't have everything it needs and it hasn't been supported properly while that baby was growing, which means that there is a much higher likelihood that there are going to be issues with the baby or with the delivery itself. What about induction? Great answer. Great question. Induction. All right, so a little bit of anatomy here. As the baby develops, the baby is in fluid and is breathing in that fluid until the baby is ready to breathe air. Once the lungs are mature enough for the baby to breathe air, the baby actually releases a hormone, which kickstarts the labor process. And that's what starts the end of pregnancy and the beginning of birth and life outside of mom's body. So what often happens is that within the medical community, then we'll see, oh, well, you're past your due date, so we want to induce. And the reality is that that's a guess date. And I'm going to get to that in a minute, because that's something really important to understand, is how that's calculated and what it really means and how your pregnancy physiologically actually works. But so if you are being induced, if you are not spontaneously going into labor, that baby is premature. I'm going to let that sink in. I'm going to say it again. If you are not spontaneously going into labor, your baby is premature. The reason I say that is because spontaneous labor begins when that hormone is released by the baby, when the lungs are mature enough to breathe air. All right, so how do we get to a due date, and how do we really calculate whether or not you're overdue? And I'm going to talk about this because this is a lot of how I function within my practice and how I deal with moms' due dates, or what I call guess dates. So a due date is calculated 40 weeks from the first day of your last period. In addition to that, the placenta is designed to last 42 weeks gestation. That begins at implantation. All right, so we have 42 weeks with the placenta. That adds 2 weeks onto the end. And then at the beginning of that 40-week calculation, there are 2 weeks where you could not be pregnant. The week of your period and the week after, unless, of course, you have mistaken implant bleeding for your period, which can happen, okay? But so let's just say that we're accurate, then that's 2 weeks that we need to add on again at the end. So we've got 42 weeks for the placenta and then 2 weeks where you weren't pregnant, which means that we have about 4 weeks of play. And what I typically tell women is that you've got 2 to 4 weeks in either direction for your guess date, okay? This is your delivery range. Right? And we can calculate pretty closely, but really it's a waiting game. And so to have a mom come to me and say, oh, this is my due date, and then go 42 weeks or 43 weeks, as long as I'm seeing good vital signs for mom, for baby, there's plenty of fluid, there's good movement for baby, and that's not an issue. Because again, we're guesstimating when that baby is going to come. Often, and I gotta say, I've got a number of grandkids now, and the majority of them, no, not the majority of them, all of them, all 4 of my grandkids from my children were born C-section in a hospital. And I witnessed stuff that just breaks my heart. And also doing doula work, I've seen a lot of bullying and unwillingness to listen to the mom and even to treat mom as a human being with compassion, which is unfortunate. And it takes away the empowerment of a mom in that situation. And it devalues her as a human being and really, I think, diminishes the whole experience of birth. In most, I don't want to say primitive, but I guess that's the best way to describe it. Many of those cultures, birthing women are given the same status as warriors. I want you to let that sink in for a minute. The strength of a woman, it comes from many places, but in this instance, there is that empowerment of bringing forth life that is inherently female. Okay? If you were not born female, this is not a power you possess. And I'm not saying that in some, women are all powerful, girl power kind of thing. I'm in a physiological, very balanced, natural setting. This is a power that is strictly female in everything in nature. And so, and somebody's gonna hit me with like some asexual flatworm or something somewhere, but I mean, you guys get where I'm going with this. So what we need to understand is that taking that away, because this is something that is primal for us in our genetic makeup and in our own spiritual being. It's just part of us. That process of giving birth needs to be a moment of empowerment for a woman, and not a situation where she is devalued and all of her power is stripped away, which is often what we see outside of home births, which is unfortunate. And so birthing at home is becoming one of these things where, my largest midwife clientele are second-time moms who had bad experiences in the hospital. And most of the bad experiences did not have anything to do with any medical issues. It had to do with how they were treated. All right, so I'm going to get off of that little topic there. And we've got just a few more minutes. And I'm going to leave it open here for questions. What do you guys want to know? What are your questions about birthing outside of a hospital or pregnancy and delivery in general? As I sip my yummy jasmine tea. Thanks, Dave. Nobody wants to be the first to ask a question, right? All Alrighty, kids. Last call for questions. I'm gonna do some kind of cleanup here and then answer any questions that pop up. First off, I want to thank Rusted Leaf Tea Company again for sponsoring today's episode and for the lovely sampler packet that they gave me. Dave is offering these sampler packets for like $15. They're great. I'll link all his info in the comments below after this broadcast is over. Also, we now have a Patreon page where I have set up some great perks and information for anybody who wants to get involved there. There's a number of different tiers. We have tiers for everyone, and then tiers for practitioners as well. So those of you who joined us today who are natural practitioners, midwives, massage therapists, health coaches, you name it, anything natural and holistic, non-toxic, non-invasive care, supporting the body's natural healing ability, treating the person as a whole, rather than just looking at the symptoms. We've got a section just for you as well. I will put the link to the Patreon page below. Also, new content for that will be dropping next. I'm going to go with Wednesday, and I'll update you if that's not where I put it on my calendar. So I will put that Patreon link below, as well as the links for Rusted Leaf Tea Company. And then right now we're doing this on Fridays. It seems to be working well for people because we're all homebound and not doing a whole lot on Friday night. However, historically, Fridays have not been great for people to make any kind of event, even if it's online. So we are looking at moving to Thursdays. I will create another event just like I did for this episode for the event coming out in 2 weeks, where I will be talking about how I got into naturopathy and how I am practicing now, and just taking your general questions about getting into the field and anything holistic, natural healing, and natural living in that. Guys, leave your comments below. Anything that you would like to learn about. What would you like me to talk about? I'm always taking suggestions to fill up this content, as well as for other mediums. We've got a lot of stuff coming out on YouTube. Don't miss it, because coming soon, we've got a What's on the Menu coming to YouTube. And then there's some Patreon exclusives for that show. So make sure you check that out on the Patreon page as well. In that, it's a cooking show, guys. I'm gonna be making food. Everybody loves food, so come cook with me. And thanks so much for joining me on Friday night. I appreciate your time here. And doesn't look like there are any other questions, so we're gonna close it out for tonight. I will see you next time. Thank you again for joining me. Remember to be kind to yourself and be kind to others. You guys have a great night. Thank you.